Welcome to Doctors on Call. I'm Jenna Miller. IV therapy, or intravenous therapy, is a procedure that delivers fluids, medication, blood, or nutrients directly into a vein. It's a common invasive procedure that can be used to treat a variety of conditions. IV therapy can be used to treat chronic illnesses, vitamin deficiencies, and severe dehydration. How does medically assisted weight loss work? What are the benefits of massage therapy? We'll learn more about these services and more on Doctors on Call with our guest, nurse practitioner, Nikki Cherryholmes.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital, experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Nikki Cherryholmes is a board-certified nurse practitioner with 4 years of experience as a NP and a background in trauma ICU nursing. We're talking about IV therapy. It's also known as intravenous therapy. And Nikki, this is your first time on the show, so we'd like to welcome you, and we're so happy to have you here tonight.
Thank you for having me.
All right, so we're going to get started. First of all, we'd like to know a little bit more about your medical background.
Okay, so I was RN for about 4 to 5 years, and I worked at Wesley Medical Center in the trauma ICU. So that's kind of where my passion was ICU. I knew that I wanted to further my degree, and so I went back to school to get my master's and became a family nurse practitioner. I have worked in the as a traditional nurse practitioner, and then I just recently, about 2 years ago, I opened up my own business to encompass IV therapy, weight loss, and now direct primary care.
Okay, so now is there something that happened? Sometimes you'll hear these journeys that people have. Is there something that happened that gave you this new passion of yours?
Yeah, so I realized that it is very hard to balance family time with the corporate world. So it's much easier to be your own boss and to kind of set your own hours and just the flexibility that comes with that. I have a lot of children, so I'm very thankful for that. So just being my own boss and having my own business allows me a lot of time with my family that I don't think I would get otherwise.
Sure, absolutely. So let's talk a little bit more about what services you offer.
Okay, so I offer IV therapy. That was the first service that I started to offer when I opened up my business. There you have seen probably a lot of IV therapy locations in Wichita or in Kansas City. So I was the first one to open it in Hays, and I knew that with Hays being my hometown, I love watching it grow and expand, and in order to do my part as a member of the community, I wanted to add something that wasn't already there so that I could just be a part of the growth. Another one of the services that I offer is weight loss therapy, and I did so because when I was working in the traditional primary care setting, I saw how hard it was for individuals to be able to get weight loss medication. It either wasn't affordable or insurance didn't cover it. And then direct primary care, that is just a new approach to primary care where I don't accept insurance, so it's just a cash pay for all my primary care members. And again, it was just a new service to Hays and something that would help the community grow and expand.
Absolutely. So let's talk a little bit more about the insurance side. So you do not accept insurance, is that correct?
Correct.
Okay.
For any of the services that I offer.
Absolutely. But in a way that's, a person, I would assume, once you do a consult, they know straight up what
Correct.
They're going to
yep.
owe?
It's known very early on that I don't accept the insurance, so I do a consultation for a lot of my services, and that's where they are told, and I haven't had any issues with it. It just makes the process so much smoother.
Absolutely. Now let's talk about the benefits of IV therapy. I'm sure there are countless.
There's a lot of benefits. The more common ones that you'll see is just rapid fluid hydration. So whatever you're administering in the IV, whether it be fluids, vitamins, minerals, amino acid, you get 100% of that absorption of whatever it is that you're getting. So that will help things like dehydration. It will help with skin health. It will help with immune system boosting. any ailments or performance levels, things like that. So it's got a multitude of additional benefits, detoxification. So yeah.
Sure. Now, what do you find a lot of your clients and patients come in? What's a big pull for them to come in?
So a lot of the times people will come in with just that, hey, I just feel run down, I feel fatigued, I just don't have a lot of energy. That's usually the most common complaint. And then a lot of, especially this time of year, I get a lot of people who are trying to fight off some viruses or illnesses and just need an immune system boost.
Absolutely. So what can they expect when they come in?
So when you come in, when you first schedule an appointment with me, you will either meet me or my nurse, Riley. We'll have you fill out some consent forms and an intake form, and that will ask about your health history, your allergies, the medications that you take. And reviewing that is where we really ensure that you're a good candidate for IV therapy, because unfortunately not everybody is. So we'll go over that health history with you. And then we just kind of talk about what your expectations are for IV therapy so that we can kind of guide you in the right direction on what IV to choose. And then we get you started, we get you hooked up. It takes about 45 to 60 minutes for the IV to run. And then we get you on your way and we follow back up with you within about 2 to 3 days.
Sure. And how quickly can a patient expect to start feeling better?
So a lot of the times it will be immediate. But I always tell people you will feel your best when you wake up tomorrow morning. And a lot of the times when I'm giving you something, you will feel it kick in and then you will feel it wear off. And so that's a good time for your body to recognize, hey, I could get this every month or every 2 months. It just depends. Everybody is different. So it depends on your metabolism. It depends on your activity level. So everybody's body burns it up differently.
Absolutely. Now, how often can a person come in to do it?
So each IV has a different frequency level. Some of them are once a week, some of them are every 2 weeks, and then some are just intermittently. I do have that information listed on my website, but again, it's not meant to be an everyday thing or an every other day thing.
Sure, absolutely. And what types of IVs do you offer?
So I offer different IVs from Fluid Flush, which is just a bag of fluids with no additives to it. And that's really just meant for people who are dehydrated. So a lot of our construction workers or people who work outside in the summer, that's really great for them. We also have some immune system boosting bags so that have a high amount of vitamins and minerals. We also have what we call a power package. That's really great for athletes. We have energy boosting bag. So that will help regulate sleep cycle. It helps with energy, and we also have another IV that helps kind of regulate people's metabolism. Different things from NAD therapy to our Myers cocktail, which is like a signature IV that you will find at almost any IV therapy location.
Sure. And is there an age limit?
Yes, so for my practice specifically, not every practice is like this, but for me, I only do individuals 18 and up.
Okay, absolutely. And what range do you have, as far as how old a person can be?
Gosh, I've had people in their 70s and 80s. When you start to get a little bit older, you really struggle to drink enough water. So a lot of people will come to me just for a quick fluid hydration portion of it, not necessarily the vitamins or minerals, but people who can't keep their blood pressure up because they're not intaking enough water. So I do get, I think the oldest I've had is probably in that 80 range.
Absolutely. That's wonderful. Let's talk about, when you've talked about dehydration quite a bit. We always hear that, keep hydrated. How do you know that you're hydrated enough?
So a lot of people, I think just as Americans in general, we don't drink enough water. But a lot of the times, if you are struggling with dehydration, you'll notice your blood pressure is a little bit lower. You get a little bit dizzy or lightheaded if you go from a standing to a sitting position. If you're craving water, then you're already dehydrated. So those are just some simple ways to know, hey, I need to up my fluid intake.
Sure. And when might a person know either they just need to drink more water or they might actually need some IV therapy?
So I always tell people, if you feel like you can get in enough water, to try that route first. If not, we're happy to jump in and help with some IV therapy. What people don't understand is that any time that you drink something like water, for example, you're only absorbing about 30% of it. before your body starts to get rid of it on its own. Whereas IV therapy, it bypasses the stomach, so you get 100% absorption of all of those fluids and nutrients that we're putting in it.
Excellent. And how does a person choose what is the best type of IV therapy for them?
So on my website, I've tried to put really good descriptions in there so that people can go through it and kind of find those keywords of things that they are struggling with. So fatigue, sleep issues, not feeling well enough. But if you feel like you still cannot decide, you're welcome to call my office and have a consult with me, and I can kind of, direct you in the right IV therapy for you.
Absolutely. And what have you found to be the most popular treatments in your clinic?
Gosh, right now I would say my immunity bag is probably my number one, probably just time of year. And then my energy boosting bag would be probably equal to number one or second.
Absolutely. And you said they all last about 45 to 60 minutes?
Yes.
Each treatment? Mm-hmm. Okay. Now, do you need to make an appointment for your services?
So an appointment is preferred because that allows us time to review that health history that we talked about previously. However, we do take walk-ins. So if you're in the area and you just want to pop in and see what it's all about, you're welcome to do so. And if at that time you decide, hey, I want to try this, then we can get your intake forms sent over to you at that time, and we'll review them right there with you, and then we'll fit you in.
Absolutely. Now, you might have some people asking, is IV therapy safe? What's your answer to that?
So, yes. Obviously, you want to make sure that you're receiving IV therapy in a clean environment by a trained professional. Anytime you puncture the skin, that comes with risks, right? So risks of infection. Or, like I said, not everyone is a candidate for IV therapy, which is why we go over the health history to make sure that we're not putting you at risk for something. But yes, generally it's very safe.
Absolutely. Now, who might not be a good candidate? What are some of those credentials?
So mostly, for example, patients with congestive heart failure or COPD or lung issues. Some of those individuals cannot take on fluids in the quick amount of time that we give them outside. They can get IV therapy, but they're going to be better served in a hospital where they're being monitored.
Absolutely. Let's talk about, do you receive referrals from doctors ever?
I do. I oftentimes will get a lot of patients who will go into their primary care provider, and it turns out that they're dehydrated. And the typical bag of IV fluids in a hospital setting can run about $800. So in my setting, it's much cheaper than that. So it ranges anywhere from like $100 to about $200. So much more affordable. Now, again, it's not for everybody. There are a time and a place where you need to be in the hospital and evaluated while receiving the IV therapy. But it's also just an alternative for people who do qualify for it.
Absolutely. Now, has there ever been a patient that comes in that you have to send them on?
Yes.
Absolutely.
Yep.
Okay, good to know. Well, should pregnant or breastfeeding women use IV therapy?
So when it comes to pregnancy or breastfeeding, I am very firm in the fact that, yes, you can receive fluids. I don't allow any vitamins or minerals or anything like that in the bag when I'm giving them to those types of individuals. The only other additional thing that they could get would be like an anti-nausea medication. And even then, I do require them to have a note from their OB doctor. So I've always been the type of provider that plays it very safe. So more often than not, I will say, let's speak with your primary care provider, let's speak with your OB, and to make sure that we are in agreement that this is the best treatment for you.
Absolutely. So let's talk about, you were talking earlier in the show about the direct primary care. Can you explain what that is?
Yes. So direct primary care is a new concept in regards to traditional primary care. When it comes to traditional primary care, you are likely used to, you go in, you see your provider, you pay your copay, you see them for whatever it is you need. They send that off to insurance. Insurance covers whatever they choose to cover, and then you get a bill for the remainder. Direct primary care is very different. I don't deal with insurance. So when you come to see me, you pay a flat monthly fee to be my patient, and that fee covers those primary care needs. So majority of individuals, all of their healthcare needs, about 80 to 90% of them are met within the primary care world. So the direct primary care provides, consistency. You see the same provider all the time, which isn't necessarily the case everywhere else. It's a predictable monthly fee. You get direct access to me at all times. When you call and you have questions or concerns, you're going to be able to speak with me directly, not my receptionist, not my nurse. It's that one-on-one care, and you get longer office visits. Oftentimes with traditional primary care, they're trying to crunch a lot of people in, so it's about 20-minute office visits for them, and for me it can be anywhere from 45 to 60 minutes. That allows me time to sit down, get to know you as a person, get to know your cares and concerns, and really figure out a plan of care that fits you and your needs.
Absolutely. Now, does a patient have the opportunity to send their appointment into insurance?
No.
Okay.
So typically, no. After I see them, yes, they can have all of the documentation, but I don't submit it to insurance. And most of the time, because they won't accept it on the patient's behalf. Absolutely.
Good to know. What has been the response from your patients?
I've had some really good response. I was a little bit worried with Hayes being a traditional primary care town, that it would be a little bit slower of a response, but I've had great turnout, and the next closest place would be like Kansas City and Wichita and Dodge City. So I was a little bit worried how well the direct primary care would take off, but I'm very surprised.
Excellent. Wonderful. What are intramuscular shots?
Yeah, so almost everything that we have in an IV form, we also provide in an injection form. So our injections are called intramuscular injections, and they deliver about 80 to 90% of whatever it is you're giving, vitamins, minerals, amino acids, things like that. So like I said, everything that I give in an IV form, I try to also have it in an injection form, and I do that for two reasons. It's a little bit more cost effective but you don't get the fluids with it, and it's quicker as far as time goes. It only takes about 5 minutes versus the 45 to 60 minutes for an IV.
Sure. And what are some of the benefits? I know you discussed some of them there, but what would a person, why would they need those?
Yeah, so same thing as the IV therapy. You can boost your immune system, you can boost your energy level, you can help with inflammation, detoxification. So it's got a lot of the same benefits.
Sure. And who are the candidates that usually come in for that?
So really, the IM injections is more likely going to have people that don't have any red flags as to why they can't have them. But again, it would really come down to chronic conditions on if their body can metabolize whatever it is you're giving them.
Absolutely. Now, long term, when you're looking at your patients, sometimes does it take just one session and other times it takes much longer? How does that usually work?
So initially when I started, IV therapy was so new to Hayes, I had people using me more as a reactive approach, and now they have seen the benefits of it. And so I have a lot of return customers that will use me for a proactive approach. Say, when the holidays were here, it's like, I'm going to meet with my family. I want to make sure that my immune system is where it needs to be. Let's do this before. So they would come in prior to get-togethers or prior to events or traveling. So a lot of people choose to just stay on top of their health and come and see me for things like that.
Absolutely. Wonderful to know. Let's talk a little bit deeper about the medically assisted weight loss program. How does that work?
Yes, so I offer medically assisted weight loss, which you have likely heard of some of the name brand medications. That's not what I sell. I sell a compounded version of that or a generic version. And the reason I can do so is because those name brand medications fall on the FDA shortage list. Anytime a medication falls on the FDA shortage list, another pharmacy can come in and make a generic or a compounded version of that. So it's a once-a-week injection that helps to increase your metabolism, decrease your appetite, and it really allows individuals kind of a kickstart in their weight loss journey.
Sure. And is it something that they have to continue, or do they get to a certain point that they can then stop the injections?
So a lot of people have found additional benefits to it outside of what they were hoping for. For example, inflammation, it really helps with, I have individuals who have migraines and their migraines are almost non-existent while they're on the medication. And then I have people with arthritis or joint pain that it really helps with that. So I will have people who have reached their weight loss goal and then choose to stay on a low maintenance dose for those additional benefits. If that's not you, yes, you reach your goal, we titrate you off of it. And during the weight loss program, you have learned the diet and exercise and all those lifestyle tips to really make you successful when you come off of the injection.
Absolutely. And how long does it typically take to start seeing results?
So you can start to see the results almost within that first week. You'll see the effects of it. Your appetite will be decreased. You'll notice that you're not craving the things, all the bad things that you were once craving. So it's almost immediate. But it depends on what your goal weight is. I would say right now I'm averaging about 35 to 40 pounds of weight loss in a 3-month time frame. However, I do monitor that I make my individuals come in once a week to be weighed and get the injection from me, and we go over side effects, any struggles that they're facing. So I really am walking through that journey with them, me and my nurse. And then some people, they'll have more struggles than others. So we walk through their protein intake, their water intake, intermittent fasting, things along those lines.
Sure. And how important when they start the injections is it for a person to continue exercise?
Very important. It's not, the weight loss injection is not meant to be a cure-all. It's meant to be added into lifestyle changes.
Absolutely. And so typically how long overall is a patient on, I'm sure it's person to person, but how long do they typically need those injections on a weekly basis?
So I usually recommend about 3 months. That's how I feel like most people have reached their goal within that time frame, as long as it's a realistic goal, but the program doesn't last any certain amount of time. So if they do it for a month and they reach their goal, they're welcome to titrate off of it at that point in time. If it takes them 6 months, they're welcome to do it for that length of time as well. There's no hard and fast rule for that.
Sure. And they do actually have to come into the office to get the injection.
Yes.
Is that correct?
You will find other individuals will ship the medication home to them and allow them to draw it up and self-administer. I find that the accountability portion of it, having them come in once a week to step on the scale, for me or my nurse to draw it up as we're trained to do and inject it, and then check with them to make sure that they're not having severe side effects, or to give them any tips and tricks on things that they're struggling with. A lot of people really enjoy that aspect of it.
Sure. And what do you say to those individuals who might be a little bit nervous around needles or injections? What for this or for the IV therapy? What do you have to say to them?
So we have a very relaxed atmosphere, and our goal is to make you as comfortable as possible. When you walk in my doors, it will not look like a clinic, or, it's a very calm atmosphere. It's very relaxed, and the nurse that I have on staff is very good at helping individuals feel like they're in a safe space. So if you come in and you have questions, we're happy to answer those. If you just want to come look at our space, or have a consult, or chat with us about, what the process is, we're happy to do that. And a lot of times that will calm people's nerves.
Sure. Now, sometimes you think about, your intravenous therapy being several people in the same room. Is that how it works at your?
Yes, kind of. We do allow privacy. So we have an individual space, and then we have a group space. And our individual space has privacy, so that when you come in, you don't see the other individuals. But we also have a group space. We do have some larger groups that will come and do it together. We've had people that came to town for a family reunion, did it together, class reunions, work parties, things like that.
So it is an IV party.
Yeah.
Very good. Okay. We all know the benefits of a good massage. How can massage therapy improve your wellness efforts?
Yeah, so massage therapy is really good for decreasing tension, decreasing pain, helping with circulation, and then just an overall improvement in your wellness as far as immune system boosting, things like that. It helps to getting all of, with the massage therapy, typically when you improve the circulation, you also detoxify the body. So that's where it helps as far as wellness goes.
Absolutely. And do you offer massage therapy in your office?
Yes, so we have a massage therapist located in my space. Her name is Amber Lang with Holistic Healing. So she does a wonderful job. So if you have never tried her, I would recommend it. A lot of my nurses will use her too. So that's where they'll take their lunch breaks or afternoon breaks. But she does a wonderful job. So
absolutely. And there are by appointment only, or do you have walk-ins?
I don't think Amber has walk-ins, so it's just by appointment only, but you're welcome to call the office and chat with her about that.
Absolutely. And we have just a little bit of time left. I know some of the care you do is for people who are suffering from hangovers. Let's talk about that.
Yeah, so when I started IV therapy, with Hayes being a college town, I thought it would have a lot of hangover IVs. However, that has not been the mainstay of my treatment. I do get some here and there, but for example, when we do a hangover IV, we call it the sip and drip, and it helps to replenish the fluids that you've lost. It also helps with the headache that comes with having a hangover. It helps with the acid reflux, and it helps with the nausea.
Okay, excellent. Well, all kinds of great information tonight. We thank you so much for being our guest. That is Nikki Cherryholmes from SecondWind IV and Wellness in Hayes. On our next Doctors on Call, we'll be discussing arthritis. You can email questions for our next program. That address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.